Stacked rocks, more commonly known as cairns, placed along the trail signified that you are on the right track. It is a marker guiding you to the correct path or trail in cases where navigation becomes difficult and the trail may be easily lost. Each breast cancer path is unique. Our intention is to place cairns along the trail, encouraging and empowering you on your journey to wellness. Join us as we unpack the 4 core for stage 4 principles that empower you to make positive changes that can affect both your cancer diagnosis and also your life. Focus and fortitude, faith and forgiveness, food and fuel, and family and friends.
Welcome to 4 Core and More for Stage 4 with your hosts, Lori Lober and Allison Rash. Brought to you by Breast Cancer Wellness Media. In our conversation today, we had the opportunity to talk with Dr. Philip Salem, a world-renowned cancer physician, researcher, and author. He also happens to be Allison's oncologist. He's the Director Emeritus of Cancer Research at Baylor St. Luke's Medical Center in Houston and President of Salem Oncology Center. Between 1989 and 1994, Dr. Salem served on a White House Advisory Committee on Healthcare. He has over 50 years of experience in cancer medicine.
So for this episode of our journey with stage 4 metastatic breast cancer, Allison and I are so honored to present Dr. Salem. And I have goosebumps just saying his name because he is, in a way, responsible for my cancer journey with regard to bringing my lead oncologist, Dr. Daniel Boozer, to the United States and to MD Anderson. And I know I say, oh my gosh, I keep getting goosebumps. I just, I don't know what I would have ever done had I not found Dr. Boozer or he found me or the world connected us. And I just think there's so much to that, Allison. I mean, people have come into our lives because of metastatic breast cancer that we wouldn't have had in our lives otherwise. And I just saw him hug you just 30 seconds ago, and I can tell that you guys have a wonderful bond. And that is one of the things that I feel like is missing so often with many, many doctors. And you found a good one, girl. You found a good one. He's written a book, and I'm sure he's done a lot more than that. But this book, you guys, if you've not put your hands on this book and you're fighting stage 4 metastatic breast cancer, get this book now. We will talk about it just a little bit, but Dr. Salem, thank you so much for being here for this segment. We appreciate your time. We know how busy you are. And I'm telling you, I've got goosebumps just meeting you virtually. So thank you for being here. And Allison, you are to be congratulated because I know you got some really good news today.
You know, what you said about the relationship I have with Allison, I would like to take this as an example of what I do not consider right in American medicine. Because in American medicine, somehow you are being indoctrinated in a manner that you need to keep a distance between you as a doctor and the patient to be able to make the right decisions. In cancer, I believe this is not correct. I believe it is of utmost importance that the patient feels that he is being cared for, that he is being loved by the people who treat him. Because that relationship is so important for the patient and for the doctor. For the patient, it gives the patient the fuel, the gas. Like a car, the car needs a gas to go. The patient needs hope, needs love, needs caring. That's why the motto of our center is is medicine beyond caring, even more than caring. You have to go the extra mile. When you love a patient, you feel you have the obligation to go the extra mile and give the patient the very best treatment. For example, when she called me and she said, I have little pain this somewhere in my body, it meant a lot to me. I modified the diagnostic tests. Luckily, turned out everything to be great. A great pleasure for me, a great pleasure for her. But that dynamic love-care relationship between the patient and the doctor, to me, is of utmost importance. It's not important, it's of utmost importance. Otherwise, many patients in cancer medicine lose hope, get distressed, and decide to stop therapy. You need to pump them with hope, with love, with care, so they develop this perseverance attitude, the attitude to go forward, to beat the disease. You cannot beat cancer if you don't have this fuel, which is love, caring, the fact that somebody really cares for you, that you are not a number, you are not a statistical thing, you are not an object, you are not a body, you are a human being. You have a name, you have a father, a mother, you are a mother of children, a father of children, the son of a father. Human beings are not objects. That concept needs to modify American medicine, because somehow doctors, because they get so busy, because of digitalization, computerization, all the stuff, they don't see the human behind the disease anymore. We need to see the human behind the disease. We never treat diseases in vacuum. We treat people who have diseases. That concept is extremely important to install in American medicine. And you know, when a colleague of mine comes to visit me here at Salem Oncology, they get surprised seeing me hugging patients. And some of them may consider this not professional, that you hug a patient. I consider it the epitome of professionalism in cancer medicine. And my motto has always been, as I said in my book, the doctor who does not love his patient, in cancer I'm talking, the doctor who does not love his patient cannot cure him. Because to cure a patient, you need to go the extra mile. You have to give the time. You have to have the caring day and night. Otherwise, the patient will feel lonely, will be the victim of despair, decide not to continue therapy, and we all know what happens when you decide to stop therapy.
I hope that a lot of other healthcare professionals can end up seeing this and hearing your words, because I 1000% believe that Dr. Boozer from MD Anderson, when in the very beginning, when I was diagnosed at stage 4 back in April of 2000, he did everything that you just described as well. So you taught him.
You know, I always loved Dr. Boozer because I thought he's the right doctor for oncology because he has the heart. That's why I emphasized in my book, if you are a Nobel Prize uh, laureate, if you are a Nobel laureate in oncology, and if you don't have a heart, you are not going to be a good physician. There is a big difference between a researcher and a physician. A researcher may not need the heart, but for a physician, the heart is a must.
I agree. And what a wonderful example of that you are. I'm telling you.
And
I got a little choke.
one of the major differences I had with the policies at MD Anderson, because when I was at MD Anderson, I was never evaluated as a physician, always as a researcher. And I kept saying to the people above us, this is not fair. When you have a doctor touching a patient, he needs to be evaluated as a physician. If we are only researchers, that's a different issue. But we are researcher physicians, we need to evaluate our doctors. Otherwise, the doctors deteriorate in their attitude and in their management of cancer patients.
And I love that you always knew you wanted to be a doctor in honor of your mother. I mean,
Absolutely.
that is such an awesome story.
You know, I entered medicine because of my mother, but I specialized in cancer medicine after a woman who was so close to me died of ovarian cancer. And I saw how she was treated. I accompanied her through the journey of pain and agony. And that's what made me change from kidney specialty to oncology. I knew very little what a journey it's going to be, because also before I started medicine, I contemplated studying philosophy because I come from a family of literature, philosophy, authors, books, articles. Loved philosophy. I excelled in philosophy. But I've discovered in my journey, 53 years in cancer medicine, that there is no philosophy that can teach you philosophy like being a cancer doctor, being with the sick, being with the pain, with the agony, with the human suffering. I have learned so much. People may not appreciate what I say, that I have learned from my patients more than anything else. Allison has enriched my life because seeing her cope with this disease the way she does, how could I possibly complain because I have a leak in the roof at home? When Allison is trying to save her life and she is threatened by death. This journey made me a different person, a better person. That's why I always say that every morning I thank the Lord for giving me this great opportunity to treat the sickest among the sick, those who are threatened by death. And indeed, I feel, not rhetorically, that this was a great honor for me. You know, in the year 2005, the Nobel Prize in medicine was given to two Australian doctors who did great research, but their research was built on mine, on the idea that recurrent infections in the gastrointestinal tract eventually lead to cancer. They built on this principle and they took the stomach as an example. They got the Nobel Prize. But many people in America, leaders in cancer medicine, objected because they thought that the Nobel Prize should go to the people who did my work, our work. But I was asked then, how do you feel that you didn't get the Nobel Prize when other people got the Nobel Prize based on your work? My answer was, my Nobel Prize is the patient I cure. There's nothing higher, more grand, more noble, or elevating than to save life. Whether you are after a Nobel Prize or whatever prize, the real prize is to save a human life. That's the prize.
Lori, can you see why I say just seeing him is as important as any of the infusions I get? Just seeing him is part of my medicine.
I agree, and I get it. I totally get it. It's almost like he's breathing more life and love into you as he's curing you.
Into the
And
world.
that's a beautiful thing.
Yes, and you talked about some of your research. Recently, you've done research ICT treatment.
Yeah.
Can you tell us a little bit about that?
When I was at MD Anderson, this was another issue. I didn't leave at MD Anderson 30 years ago because I was not on good terms with the institution. MD Anderson is home to me. And I can never, I'm forever indebted to it because I'm its product. But I didn't agree with certain things, like you have an idea, to put it in a protocol, to execute it, it will take a year. In the meantime, many people die. And I remember one day I had a doctor from Istanbul. He was like 25 years of age. He had a sarcoma in his thigh. And we had a group conference, and the protocol said we need to amputate the leg. And that was considered a standard therapy. I went back to my office, and then somebody knocks on the door. It was the mother of the patient. She knelt down, she kissed my feet. She said, please don't amputate my son's leg. Do whatever you want, but don't amputate it. It was a Friday. On the weekend, I designed a new treatment, which is now a protocol 30 years ago. How to keep the leg, give intensive therapy. And I treated him that way out of protocol, against the wishes of the department. And I saved his life, and I saved his leg. Every time this doctor comes from Istanbul to America, even if he's coming to Washington, he will make the trip to Houston to see me. You have to dare. You have to dare to do something innovative. And you have to treat the patient not with a standard therapy. You need to treat the patient with what you think is the best for the patient. If the standard therapy is the best, okay. But if the standard therapy is not the best, you should not be obliged to use a less effective treatment out of fear of lawsuits. Because we doctors, we should be advocates for the patients and not advocates for lawyers. And that's what's in my book, that one of the important messages I have for my colleagues is you need to treat the patient with what you think is the best treatment. Never mind what standard therapy is. And a year ago, ASCO, the American Society of Clinical Oncology, asked me to write one-page letter to the 46,000 ASCO members in the world, as what I have learned from more than a century in cancer medicine. And one of the things was this, because in America, doctors are afraid to treat with anything which is not standard because of lawsuits.
I don't know how you could summarize everything that's in your head and in your heart in a one-page document.
I tell you, it was tough. It was tough. Voltaire, the famous writer Voltaire, wrote a very detailed letter to his friend. And at the end, he said, I'm sorry for this very detailed letter. I didn't have time to make it a short one. Because you know what? It takes a lot of time to put all this stuff in one page.
Yes.
I will send you the page. Elaine, yeah, got me the ASCO thing. I will give it to Alison, and Alison will give it to Lori. I want you to read it because that page crystallizes my thinking about my experience of over half a century in cancer medicine.
With all of that
Phenomenal.
experience, you've seen so many changes and
Sure.
progress. What's the most exciting now?
The most exciting to me is the emergence of immunotherapy.
Mm-hmm.
And it's funny because I just, somebody wrote an article about people who got the Nobel Prize, because I'm originally Lebanese, from Lebanon. And it is interesting that the first man scientist to get the Nobel Prize for immunity, studies on immunity, was Sir Peter Mudawar in England. He lived in England. 1960, he got the Nobel Prize of his work on immunology, immunity, how you can take a kidney from one person, put it in another, and make sure that the body accepts it. He was called the father of transplantation, Sir Peter Mudawar. He was Lebanese. And I say 2018, Dr. James Allison here at MD Anderson got the Nobel Prize of immunotherapy. And here comes another Lebanese to take immunotherapy and combine it to chemo and combine it to targeted treatment and give the three together. You know, one day I was listening to Powell. He was Minister of Foreign Affairs, but he should have been Minister of Defense, General Powell. What's his first name? It was
Colin?
Bush.
Colin Powell?
Yeah, Colin Powell. He said in the war, the first battle is the most important. You have to use all the weapons you have to win it.
Yes.
The same thing holds true for cancer. If you want to cure the patient, you have to hit the cancer very hard with all the weapons you have. And what we have is the three weapons. We have immunotherapy, we have chemotherapy, and we have targeted treatment. So I combined them together and I gave them to patients who didn't have any other alternative. So the first patient was a young man with Hodgkin's disease. And he was treated, we shouldn't say name, but he was treated at MD Anderson, which is the #1 in the world. And after 5 years, the lymphoma expert at MD Anderson was a friend of mine. 5 years after treatment, he told the patient, we have nothing more to treat you. We have exhausted all standard therapy. We don't have a protocol, we have no treatment for you. So the patient came to me, and I thought of trying something because the patient was in severe pain because the Hodgkin's went into his bones. And I tell you what, in 2 weeks, the pain, which was agonizing, we thought of using general anesthesia to control the pain. The pain is gone, and in 1 month, he was in complete remission.
Oh my gosh.
And that was the beginning of my protocol, which is called IC triplex. We named it immediately before anybody else would take the idea and put it to test in hundreds of patients and get the credit for it. So now we are using this for all patients who have no other options. And guess what? We have recently analyzed our data. It is good for all diseases. We got 53% complete remission rate.
Oh my gosh.
Complete remission rate.
And these were people that were told to go home and
Absolutely, they had nothing. 53% complete remission rate. What could I have more pleasure or joy than, finding a treatment that effective in patients who have no hope? That's why I call it is hope for those who have no hope. That's what we offer. I can give you a copy of an article written to layman about ICT.
And that has been peer reviewed and
We already
shared that information.
sent a manuscript, and it's already published. But at that time, we only had 19 patients. Now we have like 37 patients. The complete remission remained the same.
that's amazing. I can't imagine how you feel going to bed at night and how much peace and joy this brings you and your heart to basically give these patients a second chance.
My wife tells me, you sleep like a baby. I tell her because
You're so tired.
no, I tell her because everything I do is what I do to you too. Is what I do is the right thing. I help the people. That's my job. People sometimes are afraid of failure, and failure is not easy. It's very painful. But again, I have learned that if you are afraid of failure, you will never make success. You have to dare. And of course, when you dare, you have to make some failures and some mistakes. But if you don't dare, you cannot make the change.
And you've talked before about the importance of perseverance from the patient and the doctor, because you said, as a doctor, I may fail 1, 2.
Sure.
Yeah.
We have a patient from Sicily with stage 5, not stage 4 lung cancer. She had disease everywhere, brain, liver, bone, dead, considered dead. Considered dead by the most prestigious Italian cancer center and dead by our great centers. We treated her with ICT, 3 years in complete remission. And guess what? That lady, when I go to Palermo in Sicily, have you been to Palermo, Sicily? Palermo is the capital of Sicily, and it's on the sea. And the sea is so beautiful, and there is a restaurant on the sea. So when I go to Palermo and I see patients there, and I break at lunch, I always go to this restaurant. That lady came to me, turned out to be the owner of that restaurant.
Oh. Wow. That is amazing. Allison, we need to go there. And meet him and Dr. Boozer.
And she's back to the restaurant serving people. She's the owner of that restaurant. Can you believe that?
That is amazing. That is universal guidance. And I mean, there are no coincidences, right? I mean, I think so much of this is beyond our control, and we just have to believe and have hope. And
Sure. There are many things beyond our control. But you know, my motto is you have to do your utmost. After that, it is the Lord. But don't ask the help of the Lord before you reach your utmost. You reach the end of what you can do before you ask the Lord to help.
makes perfect sense to me. Makes such perfect sense to me. Allison, should we share your good news? I mean, almost 20 years to the week. You're all clear on your scans, and October of 2001 is when Dr. Boozer told me that with stage 4 metastatic breast cancer, I was no evidence of a disease. So, I mean, it's just amazing that 20 years later, here I am sitting here talking with Dr. Salem, and I have him to thank for that. And I'm just so grateful, Allison, that you connected the two of us. I mean,
talking about 20 years, 15 years ago, we had another lady from Italy with extensive liver metastases from breast, where everybody thought that she was dead 15 years ago. We did not have ICT at that time, but we treated her. She's not only alive and well now, 15 years later, but we married her in the middle of the journey. And I was her best man. She got married, although she's Italian. One day she received the chemo. She dressed as a bride. I chauffeured her. I decorated the car. My assistant was the lady of honor. I was the best man. We went to a church here in Houston and we married her, and all the Italian people in the city came to church to attend the wedding. They are still married 10 years later. Happily married 10 years later.
That is amazing.
Probably the story. I asked her, I said, why did you decide to get married here in Houston? Why not in Italy? She said, in Italy, my family were waiting for me to die to inherit me. They don't like you because you cured me, and they don't like me because I'm still alive. I want to get married with the people who love me. This is a true story. See how the human spirit could be so low that somebody is struggling to survive and the other is waiting to inherit that person. Incredible.
Unbelievable. Allison, do you have any other specific questions for Dr. Salem? I've got one more. But
okay, I've got one too. I think you've talked about the power of hope, and for someone to hear this is not curable. And I've heard you say before, it may not be curable today, but we don't know what's coming.
Absolutely.
So to stay healthy and continue to fight.
Sure, absolutely. You know, just to give you a story, because a story, I think, is very expressive to the people that they understand it. One day, I was seeing one of my patients with lymphoma in the hospital. And the internist who was following her because she had an infection, he was treating her for infection, was there. I did not recognize him. I went in, I saw this doctor, said, I'm Dr. Salem. and the medical oncologist. He said to me, I'm glad to know you, but I want to ask you, how do you sleep at night? I said, what do you mean? How do I sleep at night? He said, why are you treating this woman? She's already dead. She's stage 4. You treated her with all kinds of treatment and she did not respond. Why are you giving her these toxins and for nothing except toxicity? So, of course, I was kind, but I was firm. And I told him about the importance of perseverance. This woman was an example of how you may not respond to a treatment, or in fact, you may not have a treatment at all, but if we can make the patient live longer, the patient may receive newer drugs that emerge that could be very useful. And in fact, this patient who never responded to anything, Rituxan came on the way, one of the drugs, new drugs, and I gave her Rituxan, and she's cured. She's now 20 years cured. And one day, as if the Lord had arranged it, I was walking with her on the sky bridge that connects my building to the hospital. And whom do I see? I see the internist. I say, Dr. So-and-so, hi, how are you? He said, fine, how are you doing? I said, do you recognize this lady? He said, no. I said, this is the lady you told me, how could I possibly sleep at night? She is cured completely of her lymphoma. So
that's how you can sleep at night.
Curable today may become curable tomorrow.
Mhm.
And hope is the gas for the patient to go forward. Without hope, we all need hope. The healthy and the sick need hope, but certainly the sick need a lot of hope. And without hope, it's like a car without gas. You know, you cannot go forward without hope. Hope gives you the energy to fight and beat the disease.
Yes. So, Dr. Salem, if someone were to see this interview with you and they've just heard the words, you have stage 4 metastatic breast cancer, what is the one thing, maybe the top 2 things in your opinion they need to do first?
First, I would tell the patient that fear is her enemy number 1. 2, I tell her that treatment has improved so much that even in stage 4, there is a chance of cure. And that her only option is to fight.
Embrace the best that Western medicine has to offer, get multiple opinions, go see you.
Whenever you come to Texas, Lori, I'm here for you.
I hope I come to Texas and meet you and we can do it for the fun of it, not because I need you.
Sure.
Dr. Boozer and you and Lori and I.
If you come, if we can orchestrate it in a way, you come, and I will invite you for lunch here in my office, you, Dr. Boozer, and Allison.
I just got goosebumps again. We'll do it.
It will be the best lunch.
Yes.
Okay, that is one of the best invitations I've ever been extended in my entire life. I will tell you right now, that just made my day, made my night, made my week, and maybe my month. That was so sweet. Any closing words?
This woman did a lot of good things for me. And one of them, introducing me to you today.
Yes.
Oh my gosh.
The only word I have after 53 years in cancer medicine, I'm more excited now than I had ever been before. And I'm far more thankful to the Lord than I had been ever before. That's all I have to say.
And I thank the Lord for you
Oh,
and for Lori and for Dr. Boozer.
and for the whole world. We
Mhm.
wish the whole world better.
I just don't know how this could have offered anyone more hope if they watch it and they're looking for it. I know I have hope renewed. Again, just seeing you and hearing what's coming out of your mouth and knowing that it's coming straight from your heart. And the world just needs more people like you, Dr. Salem. So thank you for everything you're doing. And I can't wait to give you a hug.
Us can make the world looks little more beautiful, can add to the world more love, more compassion. There's so much violence, hatred. There's so much material acquisition. We need a lot more of love and caring. You grow with caring. You grow with giving. And there is no giving bigger and more noble than giving life. Because, many people talk about giving. You can give of your time. You can give of your money. You can give of so many things. But the greatest level of giving is to give life. And when I look at Allison, she's alive, she's beautiful, she's adding a lot to the world, beauty, charm, love, enriching her husband, enriching her children, enriching me and the world. How proud I feel. She made my day today.
And you've made ours.
She's my trophy.
Thank you so much.
Thank you.
Thank you so much.
You're more than welcome.
I could listen to Dr. Salem's stories and wisdom all day long. To learn more about Dr. Salem and Salem Oncology Center, visit their website at www.pasalem.com. And also check out Salem Oncology Center on Facebook. If there's one step that you can take today based on the wisdom that we just heard from Dr. Salem, that step might be to look for places where you can add more love to this world, where you can add more compassion, and where you can help make this world a better place. And always remember to look for the Karens.